Welcome to our side event at the CND. Thank you for making it to the end of the week with hopefully some energy to spare and some headspace to take in what we will present to you today. It's been a very fruitful and engaging week here at the CND. We've got a very exciting event for you today. Please take this opportunity to introduce yourself in the chat, write your name, your organisation, and even where you are in the world. It's really nice to have that record and also to know who's here. So this side event is called a responsible legal regulation, a pathway to good governance and planetary health. And my name is Clemmie James. I'm a lead campaigner at Health Poverty Action, working on drug policy reform. So I imagine that we are all acutely aware of the climate emergency and the fragility of geopolitics at the moment. Today, we need an urgent change of tact to reconsider how current global drug policies, indeed all global policies, function in the context of climate change. We need to ask ourselves, do policies exacerbate climate change, or do they in fact create structures that support us to stay within planetary boundaries, avoid environmental tipping points, and save lives? Today we are asking, how does prohibition serve us in this context? Does it mitigate global injustice and climate change, or is it a barrier to adaptation efforts by causing corruption, ecocide, mass poverty, and inequality? We've known for some time now that prohibition undermines and has a negative impact on the majority of the 2030 Sustainable Development Goals. Drug policy has been used by governments for over 60 years as a successful tool of control and oppression for particular groups of people. Its motivation has always and continues to be racist. It disproportionately resulting in its motivation has always been and remains racist, resulting in policing, criminalizing, and mass incarceration that is disproportionate in both scale and approach towards communities of color, indigenous peoples, and marginalized groups. What's more, it undermines democracies, threatens gender justice, undermines public services, and diverts money away from sustainable development. And now, with the most recent report from the Intergovernmental Panel on Climate Change, launched only a few weeks ago, that has emphatically urged us to build climate resilient development to be implemented globally with immediate effect, in particular in regions with high levels of poverty, water, food and energy insecurity, vulnerable environments and degraded ecosystems. These regions already face non-climate related challenges that will obstruct and delay climate resilient development. And one such challenge is the outdated, lethal policy of prohibition that we will argue today has no place on our planet anymore. So shortly we will be hearing from Neil Woods, former undercover police officer from Law Enforcement Action Partnership, Europe, identifying the far-reaching harms of prohibition, in particular as a vessel for enabling the excursion of power by state and non-state actors, whose agenda is not one of climate mitigation, but rather government fragility and weakness. Following this intervention, we will learn from our colleague in Mexico, Romina Vazquez from Instituto, what mechanisms can be leveraged through new regulatory models to strengthen governance and social justice. We will then learn from Thomas Kai in Cambodia from Health Poverty Action about programs that become possible when multiple stakeholders collectively sidestep prohibitionist policies to achieve a health-based, life-saving harm reduction services. And finally, we will move on to Sylvia Kay from Transnational Institute, who will showcase the opportunities for environmental protection, safeguarding and justice made possible through the legal regulation of drugs. So with no further delay, I will pass you over to Neil Woods. And I do hope that this event will help join the dots and inspire action to end prohibition and integrate drug policy reform into the wider social justice and environmental agenda. Thank you. Over to you, Neil.
Thank you very much, Clemmie. Thank you, everybody, for coming to listen to this today. What I'm about to say, I am saying it with the collective experience and knowledge of the worldwide movement of which I am a part. Prohibition is the mother of crime. And unless we acknowledge that very basic fact, we will not be able to tackle this growing climate emergency. The National Crime Agency and other worldwide crime agencies make the point very, very clearly that the money from the illicit drugs economy is reinvested into other forms of criminality. This is made very clear and very widely understood amongst policing agencies. Another way of putting that is that the money from the illicit drugs economy makes other crime possible. It is the investment bank for other crime to take place. Now, the most important aspect of this crime that we need to talk about today is corruption, because organised crime always invests in corruption. But it is the mechanism of trying to police drugs which causes this corruption and accelerates it. And this is a key point that we have to understand when we're talking about this environmental catastrophe. I'll explain how that mechanism works. Where police have a success, or what is seen as a success, by arresting a gang or a kingpin character who control the drug supply in the quarter of a city, the gang or kingpin character that is most likely to take up that opportunity created by that policing activity is a gang which controls another quarter of the city. What that means is they expand their control of a market, they increase their wealth, and in so doing, they increase their disposable income. And if you have more disposable income, it will always be invested into corruption, always. And this happens at every single level, all over the world, in rich nations and poor nations alike. This mechanism means that governance is eroded away and control, power goes away from government to criminal institutions. This monopolization or cooperatives that are created through this corruption plays out all over the world. And one good example of it is Mexico, where at one point there were 20 cartels. Now there are only 3. Each of those 3 cartels has greater disposable income, a greater GDP, as it were, than most West African countries. And if we consider what's been happening in West Africa recently, there have been 5 military coups in West Africa in the last 12 months. Those military coups have been about the control of the greatest financial asset of each of those countries. And the greatest financial asset of each of those countries is the wealth that is being generated by the transit of the cocaine trade from Latin America into West Africa, where it is then distributed to the consumer countries. Now, this is blanket, catastrophic corruption, because the rich consumer countries look to the global south and point their finger and say, sort out this problem and stop your deforestation. But how can a nation stop an environmental catastrophe if it does not control its own backyard? And this is the brutal truth of the situation that we have. And this corruption is only going in one direction. It's only been going in one direction for the past few decades. We can see the direction of travel. We can see how corruption has grown and grown, so that we now have entire nation states fighting over control of this wealth created by the trade. We cannot ask, or rather we can ask, but we shouldn't expect great results of countries that do not control their own forests. Now, we know that there are ecological crimes. There are trees being cut down for profit. And we know that this is through transnational organised crime. the same transnational organised crime groups quite often that controls the illicit drug trade. But we have to be aware of the scale. The value in trees is a tiny, tiny fraction of the vast, vast $500 billion of wealth that is created by the illicit drugs trade. As I said, prohibition is the mother of crime. It's the starting point. It's what makes all of these other things possible. It's what erodes our institutions. Now, we have a very real situation here where I can see only two truly long-term solutions to prevent the climate catastrophe when looking at it through the lens of prohibition. We either get, at the very highest level, we get drug cartels around the table to talk to them about their control of the equatorial forests, or we take bold action to take the power away from transnational organised crime, because their power is the illicit drugs trade. And if we want to take back control of those governments, if we want to empower those exploited nations, if we want to take control of the environment and stop the deforestation, we have to take the power away from transnational organised crime. For decades, the institution of the UNODC has ignored the growing crime, the growing deaths, the increased availability of drugs, the increased consumption, and all of the other harms caused by drug prohibition. This has been ignored for ideological convenience. Will we now look at this growing catastrophe and this unfettered deforestation for ideological purposes, or will we decide to take action? This is something we can't ignore, and these are linked. The cause and effect here is very clear. So I would implore all of our comrades in the environmental activist world to please join with us. Let's explore ways of achieving legal regulation, because that is what will ensure an end to the exploitation of the poor, because organised crime has always exploited poverty and inequality. But it will also help us ensure that we are working together with one voice to do what needs to be done. And on that note, I'm going to hand over now to Romina.
Thank you very much, Neil. It's an honor for me to be at this side event today. The resolutions of the CND are a fundamental piece to know the direction that drug policies will take in Mexico and the world. So how significant that we are gathered here in parallel conversations to broaden the debate. Sorry, I'm going to speak quite slowly because I'm not a native English speaker, as you can see. I'm sure I'll have plenty of pronunciation mistakes, so I want to make sure that my colleagues on the blogging team understand me. So, yeah. As we all know, the harms of prohibition are many, and the environmental harms are mounting. In Mexico, the criminalization can range from people who use drugs to anyone associated with the illegal market. Here in my country, a crime that involves drugs has the name of crime against health. And for example, for women, these crimes against health are the second leading cause of imprisonment in the common law, and the first one in federal law, according to data from the National Institute of Women. Also, the prohibition is incompatible with good governance and peace building. The absence of a regulation with social justice exacerbates violence, feeds social marginalization, and encourages corruption. In terms of climate emergency and environmental issues, we have the crop eradication policy implemented in Mexico for decades, which has intensified in recent years and has led to more and more poverty of the communities dedicated to the cultivation and production of plants such as cannabis and poppy. For example, in 2020, the Ministry of Defense applied more than 2,000 aerial spraying operations, making use of polluting agents that not only ruin illegal plantations, but also contaminate wildfire rivers and other local crops. Drug policy reform is one of many steps that will need to be taken to confront global corruption and environmental damage taking place. However, it is a much needed first step. Legal regulation is part of that, but it must be done carefully, flexibly, and with intention. Regulation will free these communities from illegality, giving them a space in the market without fear of repression. The communities that are under the control of extortion by army groups and the violence inflicted by the state will now have the possibility of selling their crops. So the creation of legal business by those involving commercialization and the end of the use of harmful pesticides to destroy crops will also contribute to the fight against poverty and hunger and generate trust in the state again. Regulation with social justice implies ensuring that those cultivation communities that have experienced years of state violence and extortion by organized crime participate preferentially in the regulatory model, providing opportunities for thousands of people who are currently in illegality. Jurisdictions should implement social justice mechanisms that address the needs of populations that have been affected by prohibition. So cannabis regulation must recognize the prohibition along with economic and gender inequalities have created disparate conditions for participation in the regulated market. At the same time, it is necessary to recognize that there are national and foreign industry with large capital interested in co-opting the American cannabis market once it's regulated in order to avoid the formation of corporate oligopolies and promote a horizontal and inclusive market that fosters decent participation under fair conditions for vulnerable communities. It is essential to incorporate a social justice perspective. Legal regulation also should have a reparation focus. So in Mexico, we are pushing for the following in the legal cannabis bills: effective decriminalization, exclusivity of license and vertical integration for specific communities, non-profit models such as cannabis clubs, and opportunities for rural communities. It is essential to eliminate decriminalization of simple possession, that such a step will be fundamental to despressurize the justice system in our country. Each arrest of a user, even when no criminal action is taken, implies the use of public resources that should be redirected to the investigation and punishment of crimes that truly affect third parties. The crime helps to reduce corruption and estrange rule of law, exclusivity, and limits on vertical integration, attempts to curb corporate capture of the market. cannabis clubs can be used as a non-commercial avenue, and accompaniment by the government can help build opportunities, strengthen trust between communities and the government, reducing displacement, fomenting access to basic services such as schools and health, provide greater rights for communities that cultivate. Regulation of cannabis is only a first step. Absolutely all drugs following poppy must be regulated in our country to reach our goals. And thank you very much for your kindly attention. Now I'm happy to introduce the next speaker, my colleague Thomas Kay, the program coordinator of Health Poverty Action in Cambodia.
Thank you, Sylvia. And I don't want to say good morning or good afternoon, everyone. And today I have sharing some experience on for the last 10 years working on the harm reduction. And harm reduction and legal regulation, the linkage about that. Next slide, please. Yes, and harm reduction actually is quite controversial in the Asian countries, but during the past few decades has been more popularized, promoted in the Asian countries, and then a lot of challenging compared to the West. There are different kind of challenging compared to the other part of the world. And the challenging is from the prejudice based on the local traditional culture. Like country like China and also the Eastern Asia and the Southeast Asia countries, in the traditional, they have a very strong prejudice on the drug use. And develop community-driven pilot based on the demand of the people who use drugs community. That was important strategy we have been adopting, and then involving healthcare partners, because healthcare partners are from HIV/AIDS and also hepatitis transmission. This is an entry point, and further explore to multiple partnerships such as law enforcement, medias, etc. And hand in hand with all partners, sidestepping prohibitionist policies. There was another way we have been trying, and we will generating convincing evidence and advocate for the policy change. So next slide, please. And example number one, this is what we have done in UC City in China. Look at the first picture. We call this place a safety harbor. Safety harbor is, we started working with the healthcare partnership, and then we set up a methadone clinic there. In this, and then further we explore to the police, local police authority, that we're getting the commitment. Actually, this oral commitment, but actually it lasts for 10 years already. So within 1 kilometer of this building, no police will arrest or harass the people because of drug use. And so this is, I think in China, it was very difficult to happen, but we make it happen through the partnership. And the second, we also, instead of confrontation, we bringing every 2 weeks, we bring the policeman into the center to have a chat with the drug users community, to have a positive dialogue on that, and try to getting better understanding. And look at the third picture. What the policeman talking with one of our client is about naloxone use. And naloxone is a prescription required medication in China, and available on all the ambulance and the emergency rooms. But when the drug users, they have overdose, normally they can't call the ambulance, because they call the ambulance, the police will arrive after, people will be arrested. But in this project, after our sensitization and communication, the police and also local the health authority allow us to distribute naloxone among the drug users community. And after 2-3 years effort, it become in China, it become a model to be promoted by the government. Next slide, please. Yes, and with this small pilot, besides what we mentioned above, police also refer drug users to our center instead of sending them to the compulsory detox center. In China, actually, in most of the place, the police have a quota. So every policeman had a quota, say you need to get 10 drug users this week. If you get it, you can have a holiday. If you can't get it, then you have to have a bad record. So actually, they are trying very hard to put the people in the detox center. But with the partnership, we make them refer the drug users to us instead of send them to the center. With all these practices, the local police, they record that finally, after 3 years, they found out that the local drug user related crime dropped 70%. So this is a very positive argument, because the traditional thinking is put them into jail, then they will be peaceful from the society. Actually, we don't have to do that, right? So next slide, please. Yes, this is another case at the China-Myanmar border, right? Look at the left side. That was in 2015 or 16. We set up a service center, harm reduction service center, including naloxone, methadone, and hepatitis treatment and HIV treatment on the side of the border. And you see there's a man sitting on this cement concrete. That's the border. And there's a policeman walking, patrolling over there. So actually we have agreement with them that because drug users, normally they don't have the ID to entry to China legally. So they're just waiting there. When the patrol police left, they will come over to get the services. And this lasts for years. And finally, the border police, they keep an eye open on that. So later on, China has changed. They built a concrete fence to replace the before it was bamboo fence, the falling down all the time. So physically, people cannot pass by. And then we talk to the policeman, how important our work is. And then finally, we start to continue our service just beside the fence. You see the people putting their hand over and getting the methadone services and also medication as well. The police car was parking next to us. They allow us to open. Next slide, please. Yes, and besides of methadone needle exchange, naloxone services, and also HIV, HCV treatment and testing were provided through this kind of setting. So, sidestepping the prohibitionist policy is possible, and the Border Patrol Force gave a green light for all the activities. While on the other side, they reject all the drug users into the country, but on the other side, they allowed us to do it. So next. And then the case 3 is in Cambodia. And we establishing a community-based drug treatment center in Phnom Penh about 4 years ago. And this center, yes, we have the methadone services, right? And then also besides of that, we're having a space to allow the drug users to gathering after their treatment, and they also getting some share cost food supply. So in traditionally, the policy is they will forbidden the drug users to gathering, because they gathering together is a bad thing. They talk about drug dealing and then or other criming, but we're creating a enabling environment for them. Next slide, please. Next, yes. And then also methadone. Oh, sorry. Can we back? Yes, methadone was forbidden to take out of the clinic. So with our new experiment, getting the police permission, we have the first take-home dose for the people. They can carry a little case to bring the methadone home for 2 days. So instead, they don't have to running over to the clinic every day. And the middle one is also the naloxone distribution. And the 3 kids over there is actually, when we care about the drug users, also we found out in Cambodia, a lot of drug users, they are homeless, but they have children. So nobody look after the children, and these children living in the homeless condition, their health, well-being, everything are concerned. So, but we've visited many organizations, they say, we can provide activity, and nobody accept them for comprehensive care. So finally, we set up a kids center and look after these kids until their parents are stable, right? So next. Yes, and in these centers, we have adequate dose adjustment for case by case for better compliance. And also we're supporting the counseling and the gathering, naloxone distribution, take-home dose, and also we can look after the children's. And also in Cambodia, we also encourage the police refer drug users to the services instead of sending them to the detox center. Next, please. So the next step, and actually with the last CND, we inviting our partners to Vienna, not just go to the conference, we also visiting the pill testing sites, and we see the benefit. It was operated by NGO. So after coming back, we're making a plan to set up the first pill testing with the police support. And but because of the COVID, we have delayed the process. So we hope that next month we can restart it again. And also we will put in professional drug counseling and the buprenorphine treatment available in the country. Next. Yes, and sidestepping prohibitionist policy is possible with multiple partners. And this is our conclusion. With these pilots, all partners working together can strengthen trust in public services and save lives. When government service plays a healthy approach and not a prohibitionist one, then the better public health and governance is reached. So I thank you very much. I'm a bit over time. I would like to hand over to next speaker, Sylvia.
Thanks, and thanks, Thomas. That was really inspiring, all those examples. I was really moved by that, actually. So I want to return a bit to the whole planetary boundaries piece of this webinar and comment a bit on the connection between drugs and matters of environmental justice. Although rather than a connection, I would describe it as a great disconnect. This is the result really of the siloing of drugs into the realm of crime and law enforcement, rather than bridging to the domain of development, and has, I will argue in my inputs, led to a number of distortions that in many ways heighten the risks that were intended to be mitigated, rather than alleviate the issues. So in relation to environmental sustainability, it's meant that within drug policy circles, to the extent that environmental concerns are addressed at all, it is through the lens of viewing drugs as an environmental threat. So whether it's cocaine production that's leading to deforestation in the Andean Amazon, drug traffickers that are encroaching on protected biospheres in Central America, opium poppy farming that is depleting groundwater tables in Afghanistan, cannabis farming that has led to soil erosion and the loss of biodiversity in the Rif region in Morocco, or the dumping of toxic chemical waste from the production of synthetics in Belgium and the Netherlands, all point in one direction. A broad picture is painted of untrammeled environmental harm. And I do want to stress that these environmental harms are very real and are a major cause of concern. But I nevertheless want to nuance or complicate this picture a little bit, particularly if it leads us down a solution pathway that, in order to save the planet, we need to just say no to drugs. I would argue that this narrative is problematic in a number of ways that I want to outline briefly. First is in relation to the question of balance and proportionality. So even recognizing the complex interconnections between the illicit and licit economies and the many spillover effects these produce, I think something that Neil perhaps also touched on. The environmental harms related to drugs pale in comparison to those produced by, for example, the expansion of soy monocultures, palm oil plantations, and the extractive industries related to oil, gas, and the mining of minerals and metals, all of which are, to some extent, legal extractive industries and are major global drivers of deforestation and greenhouse gas emissions. So that's the first point about balance and proportionality. The second point is in relation to paying attention to some of the differences in drug production economies and histories. So I'm sure most of you will know, but drug production economies and commodity chains vary across place and time. For example, cannabis production in the Rif region of Morocco really exploded and took off after the introduction of new high-yielding strains brought over from the Netherlands and the use of techniques borrowed from industrial agriculture, such as more intensive growing cycles and irrigation patterns, use of chemical fertilizers, and more broadly, the transformation of rural landscapes into monocultures. Similarly, the advent of new technology in Afghanistan, ironically, with the shift from diesel-powered pumps to green solar energy-powered pumps, which have dramatically cut the cost of production, has allowed opium farmers to tap groundwater reserves that were previously unavailable, leading to an alarming decline in the water table. This stands in contrast again to the other kind of production economy that is seen in more traditional forms of opium farming, still ongoing in upland Myanmar, for example, which has been practiced for centuries by farmers as a supplemental cash crop, in addition to other food crops and integrated within forms of swidden agriculture. So all this to say that there are environmental implications and different environmental footprints related to each of these production systems. But it's important to be attuned to the distinctions between them and the differential impacts they produce, rather than furthering a blanket one-size-fits-all approach. And this brings me to my final point around the problems associated with the dominant narrative around drugs and the environment, which is that it often underplays the hugely damaging impact drug control responses have had on the environment, something that Romina also pointed out. And she referenced there, and I would just reinforce again, the hugely destructive impact of forced eradication, for example, through aerial spraying, using toxic chemicals such as glyphosate. And then secondly, I'd also point out the well-known and well-documented so-called balloon effect, which refers to the displacement caused by efforts to evade monitoring and interdiction by drug enforcement agencies. That means that drug producers and traffickers seek out ever more remote and fragile areas, often in natural parks or protected forests or sensitive biodiversity hotspots. So that's a bit, I just wanted to introduce a bit the kind of state of play within what I would argue is the kind of hegemonic narrative within drug policy circles when it comes to dealing with issues of the environment. But shifting gears a bit to this question, okay, what kind of pathways would responsible legal regulation afford us? I would argue that responsible legal frameworks which connect the dots between drugs, public health, human rights, and environmental justice are an opportunity to reset the debate and deal head-on with some of these challenges, including pressing environmental challenges associated with drugs. But this will not happen automatically. It's not a panacea by any means. It matters very much how legal frameworks are designed. And as a sort of example of this, I want to highlight here a few learnings from some of TNI's work, working with a group of cannabis growers across the Caribbean region that have coalesced to form what is known as the Fair Trade Cannabis Working Group. And this working group has focused on the prospects for building a sustainable cannabis industry in the region, dialoguing also with policymakers and licensing authorities and investors. And much of the prospects, or to put it in more business-minded language, unique selling points for building sustainable cannabis industry in the region center also on the environmental aspects. For example, within the working group, identified a number of salient environmental points to build on for a sustainable industry. These include, for example, the ideal climate in the Caribbean, which would allow for outdoor as opposed to indoor cultivation, including warm and stable temperatures, adequate rainfall, well-drained soils, and natural sunlight, all of which allow growers to dramatically reduce the high carbon footprint, which is associated with indoor cultivation. They also point out the use of organic production methods, taking advantage in some countries also of the presence of fertile volcanic soils. And some growers and investors also align with principles of agroecological or regenerative agriculture, using, for example, natural seaweed composting and experimenting with different field sites to test what works best and also how to maintain quality control. And they also point to the presence of indigenous cannabis strains and the ability to use and preserve native seed varieties, thereby also protecting local genetic resources and diversity. And a final point which I wish to make, and one which was also stressed to me when I undertook some interviews with cannabis farmers and did fieldwork in the Caribbean, is on the impact of climate change, which, as inhabitants of small island developing states, they were keenly aware of. And growers that I spoke to connected the development of a sustainable cannabis industry with policies that promoted resilience and a sense of environmental stewardship, rather than one which replicated the harmful practices of industrial agriculture. So all of this is, I think, to underscore the point that I would really like to make in this webinar, which is the time to act is now if we really want to build a truly sustainable and green drug policy. We need to be forward thinking, not pass legislation retroactively when it is much more costly and difficult to implement. We really do have no time to waste. And with that, yeah, I think I'll hand back to Clemmie as our moderator. Yeah.
Thank you, everybody. So I hope everyone has enjoyed our whistle-stop tour of extraordinary presentations and incredibly inspiring to hear the magnitude of the connection, I suppose, between drug policy and the environment. For me, it really reinforced what happens when you make something illegal, when you push something underground. It doesn't disappear, and the immediate harms sometimes are well known within public opinion and culture, but actually the domino effect and the greater impact is what we're really talking about here. The colossal interconnection of what prohibition, so having made certain drugs in this world illegal for over 65 years, where we are now. And in the next few years, as Sylvia has said, it is not just about legally, making drugs legal. It's very much about what and how, who is part of the design process, and how these legal frameworks are designed, and what they prioritize. And what we have learned from our colleagues in Cambodia and Mexico is that there is movement, that there are positives going on, there are changes in policy and in culture, and we have learned that when stakeholders such as the police and community members and the Department of Mental Health, farmers can work together and understand that we need to move away from criminalizing and imposing stigma on people, then actually we can save lives, but also we can minimize some of this power that has been handed over to unaccountable actors. And these unaccountable actors is so what Neil was talking to us about at the start around corruption and organised crime is very much the grey, unexplored area between environment and drugs. And while my understanding is that there are sort of 3 key areas where this intersects, so I'll just highlight those to share with you. Firstly, how drugs are produced and how they're moved around the world can cause environmental harm, as we've heard this in this session. Secondly, how the trade is policed. Crop eradication, aerial spraying, destruction of family units, of entire communities who are working within that trade can cause environmental destruction. But ultimately, going back to what Neil has said, prohibition is the mothership. Prohibition has enabled $1 trillion industry that the majority of people walk around their daily lives thinking just simply is invisible, doesn't exist. Well, these people who are in that, who have been afforded that power, are unlikely to have public change. And just going back to what Neil said at the start, we either bring them to the table, we can sit at the table with us, or we look at our other options, and our other options are removing this power from those groups and enshrining in new legal regulatory frameworks priorities that serve people, that recognize the years of harm that prohibition has caused, the reparations that are required to create the egalitarian equity that is needed amongst those communities that are so disproportionately be harmed, but also moving forward in those new legal frameworks. So our ask is from this webinar is very much that we have a meeting of minds and knowledge share between the drug policy reform movement, but also the environmental justice movement. Drug policy reform absolutely has to be on your agenda. We can't be going to COPs anymore with Brazil signing on the dotted line saying that by 2030, we're going to stop deforestation in Brazil, when prohibition is running rampant in Brazil. It is incompatible. So prohibition needs to be discussed on the environmental justice platforms. And we're ready to do that with you. So I think we've got 1 minute. So I just want to say a huge thank you to Neil, to Sylvia, to Romina, and to Thomas, and my colleague Alak, who's been helping me in the background with the tech today. So thank you all very much. Thank you for joining us. And I really hope that maybe there's things you knew, but hopefully you've gone away learning a little bit more about these intersections and hopefully the urgency with which we need to begin to address them. So thank you very much, and goodbye. And hopefully you can now run through the Zoom rooms to your next webinar at the CND, and hopefully next year we'll all be in person at Vienna, because the lack of civil society in that space is really important, and we need to be there in person, and we need to be making a noise. So hopefully we'll all be attending there in person. Thank you.